last time you were here, unfortunately Assad was diagnosed with cystic fibrosis, and I know it's a very severe condition. You guys needed some time to absorb what you heard and kind of reevaluate your lives and how it's going to affect you and your whole family. But I appreciate you guys scheduling another visit. It sounds like you want to be proactive in your child's life and learn more about the condition. So I brought this little packet about the disease, just providing some general information so we can kind of flip through that together as we talk today.
So I have a question. What is cystic fibrosis? I don't know anything about it.
Yeah, great question. So basically, cystic fibrosis is a genetic disease, and it's characterized by this thick and sticky mucus that builds up mainly in the lungs, airways, and the pancreas. So when we're looking at the lungs and airways first, that mucus blocks the airways and traps the bacteria in the lungs and the airways, which causes those lung infections. Then switching over to the pancreas. Pancreas is, one of its functions is responsible for releasing this digestive enzyme, which helps break down food and absorb the nutrients from the food. But again, that mucus blocks those pathways of the pancreas, and those enzymes can't be released. And there's no current cure for this disease, but the life expectancy keeps increasing as medications and therapies are being released throughout the years.
So how do you know that Assad has a photosynthesis? Cystic fibrosis. And how do you know for sure that Assad has it?
Another great question. For cystic fibrosis, there's several different tests, diagnostic tests, to see if this is actually the condition that they have. So first off, when Assad was a newborn, he actually had a newborn screening test done on him, which it tests for, it's called immunoreactive trypsinogen, or IRT. And it's a big word, but basically it's just a chemical released by the pancreas. And in normal newborns, these levels of IRT fluctuate very little. But when the levels are higher, that warrants that the newborn might have a risk for having CF. And this test just suggests that there is a risk. So this is referred to kind of the gold standard, which is the actual diagnostic test in the sweat chloride test. And basically for that, the sweat is collected on the newborn and onto a gauze. That gauze is sent to a lab, analyzed there, and the results, if it's above 60 millimoles per liter of chloride on that test, then that is a positive diagnosis for CF. And Assad unfortunately had that above 60.
How long will he live?
On average, an individual with CF, the life expectancy is only 30 years, which is unfortunate. But again, like I said, life expectancy keeps increasing as medications and therapies and new research that keeps being released recently.
So what are some treatment options that we have for Assad?
Yeah, there is a number of medications and therapies out there for Assad, and it's important to understand that every case is different for the individual, so it kind of just depends on how he progresses and what medications, what therapies work for him. But looking at medications first, there's a couple different inhalers out there. So steroid inhalers, that can be prescribed, and that helps reduce the swelling in the airways and lungs for Assad. Then bronchodilators also, that can be prescribed, and that helps open up the airways and lungs to help him breathe better. And there's also antibiotics that can obviously help for the lung infections. And switching over to some of the therapy options, there's numerous amounts of, they're called airway clearance techniques, or ACTs, and many of them don't even involve any equipment, aren't expensive. They just, even he can perform them when he's older and learns how to do them, or just the assistance of YouTube, he can practice different breathing and coughing techniques to help loosen and remove that mucus from his lungs, or YouTube can assist in, it's called percussion, which is basically just kind of light taps on Assad's back. He'd be positioned different ways for the different lobe you're trying to work on in the lungs to remove that mucus. Then more with equipment assisted ACTs, there's a vest you could buy, and the vest is hooked up to a pressurizer and kind of pumps air into the vest through the tubes that are connected to it, and it vibrates the chest and the back, helping again loosen some of that mucus in the lungs and the airways.
So I have another question. Will Assad be able to live a normal lifestyle and play sports and exercise like his other friends?
Yeah, actually, physical activity for patients with CF is encouraged, especially at a young age. So the reasoning for that, the physical activity helps first and foremost strengthen the child's lungs. So when they're out there playing around, running around the playground, or if they ever get into soccer or baseball or something like that, they're running around, helps strengthen the lungs, and it helps slow down the decline of the lung function. And also, again, when they're out there jumping around or jumping off the playground or something like that, that kind of serves as another form of ACT. So they're loosening up that mucus in the lungs and in their airways, and hopefully they can loosen up enough and cough and remove that from the system. But with the physical activity, it depends, again, how Assad progresses with his condition. It would be hard to tell when he gets older, so as the level of intensity and as he starts competing against bigger, stronger people, he may not be able to do that like a normal person. We'll just have to see. We'll keep checking up on him and seeing how the condition progresses, but it's hard to say right now.
Do you have any other questions, Steve?
Not right now.
Well, thank you so much, Dr. Rudolph.
Thank you for coming.
Yeah.
And if you guys think of more questions, feel free to call the office. I know you guys have the number. If it's a quick question, I can even just try to answer it on the phone, or you can obviously schedule another visit. But the whole team here is behind you, and just keep us updated. We'll work with you, and we'll see how it goes.
Thank you so much.
Thank you for coming.